Keep looking at the PowerPoint. So bone markings. Bones have structures, special little shapes that allow attachment of muscle. We'll talk, WebAssign will identify tuberosities like on the ulna. Condyles would be on the femur, on the tibia. Facet is a flat spot. Fossa is a flat spot. A facet is also, those are similar. A foramen is a large opening, and you have sinuses and bones also, particularly in the bones of the face. So all of these are elevations and projections. We'll have some questions about the trochanter. We'll have questions about condyles, trochlea. So just read through this. Notice that there are openings, depressions. So foramen is a window, means window. You have canals in bone. A fissure is an elongated cleft, and sinuses normally filled with air. Okay, we're going to go through the bones you should know. There'll definitely be questions on the greater trochanter. Here's a tubercle, a facet, a condyle. Here's the humerus. There'll be questions about the pelvis and the skull. So you'll have to learn some of these bone markings. The axial skeleton is the skull, thoracic cage, and vertebral column. Everything else, all the limbs, the pectoral girdle, and the pelvic girdle, those are the appendicular skeleton. So the skull, rib cage, and spine, that's the axial skeleton. The appendicular skeleton is all the limbs and the pelvis and so on. We'll talk about a joint coming up. Here's the posterior view of a skeleton. We'll focus on femur, tibia and fibula, humerus. We'll talk about the scapula, the clavicle, and so on. So your job is to learn these names, and you'll be able to identify certain bone markings in WebAssign. Know all of these bones. There'll probably be questions on most of these. Axial skeleton is the skull, spine, and rib cage. The appendicular skeleton is the arm and legs and pelvis. So what about the cranium? So there's going to be various views. The parietal bone, the frontal bone obviously is in the front. The occipital bone forms the posterior portion of the skull. This is where the Q-tip goes. I've been having a lot of wax in my left ear. I can't believe it. But anyway, that's where the Q-tip goes to get the wax out. What's the best thing to do is use that Q-tip to pack that wax against your eardrums so you can reduce your hearing so you don't have to listen to certain people. Okay, that's not true. So we should know the mandible, the maxillary bone. We'll know all of these parts of the nose and the eye orbit, the orbit of the eye. Here's the mastoid process, the stellate process. So there'll be questions on all of these portions of the skull. Okay, we'll keep looking at the maxillary, zygomatic, and mandible. We'll get a picture here. So your job is to identify frontal, parietal, the various sutures or fibrous joints. The ethmoid is a little bone behind the superior portion of the nasal cavity. There's a sphenoid bone, which will form parts of the wall of the skull, and the frontal bone, and so on. So we have the vomer, which forms the nasal septum. We have conchae, which where'd they go? In the optic canal, I'm sorry, in the nasal cavity, there'll be these uh, bones that allow air to swirl and be warmed when you take a breath of air through your nose. Okay, so you'll know most of these bones. If you look at the inferior view of the skull, you notice that here we have the maxillary bone, the palatine bone right here, and you'll have the external acoustic canal. I tell you that's where the Q-tip goes to make sure you pack your wax against your eardrum so that you can get on YouTube and have the biggest wax accumulation so that you can make money on YouTube, because you can go on these guys in England that show uh, extraction of wax. I remember I had a ton of wax when I was teaching high school in 1970, and I went to Dr. Polito. I was a monk at the times, and Dr. Polito took his uh, otoscope and he looked at my ears and he said, "Christ, it's like concrete." So I had to have my ear. They took this big tube like a bicycle pump and filled it with fluid and put this pan that curved, and they forced this water into my ear, and out came this big chunk of wax. Okay, so again, to win at YouTube, make sure that you uh, pack that wax in there really good. And if your parents are yelling at you, uh, go study, go study. Well, just pack that wax in there and you won't have to listen to them. So we have on the ethmoid bone, you have the crista galli, which means coxcomb. You have the sella turcica in the sphenoid bone, where the pituitary gland sits right there. The foramen magnum is the big window. Okay, so here's another view. Learn these bones. Here's the bones of the nasal cavity. Here's the nasal conchae, superior, middle, and inferior. As air is drawn into the nasal cavity, these conchae cause the air to swirl in various directions, and in that process, the air is heated. Sinuses, their purpose is to give ENT something to do and get infected. So everybody probably knows that already. I hope nobody has sinus infections. Sometimes ENTs have to actually drill into these sinuses and drain them. So who knows what they're for? Are they here to make our skull lighter? Who knows? The hyoid bone is just above the the thyroid cartilage, and it's for attachment of muscles around the neck. It's a free bone, so to speak. It's held in place by ligaments and tendons. Okay, know about the uh, soft spots in the infant. I remember when my older daughter Kirsten was born. She just had a baby on July 1st, Freya Emerald. And I remember when she was born, her head was compressed, and you could see that the shape of her head had been compressed because as she was delivered through the birth canal, the pressure from the birth canal walls had compressed her skull, and that's why you have fontanelles. So you have these various sutures that are open. Here's the mastoid fontanelle, sphenoidal fontanelle. So when babies are first born, everybody knows they have soft spots. And the purpose of those soft spots is to make sure that the baby's head can be compressed to make it easier for the mother to deliver. So let's go back to here. Let's stop this, stop recording, and we'll continue to move on.